for since 1984.
At least 84.
So between 1984 and 2018, when you started with me in January of 2018, you had numbness of that big toe.
Yes.
And that's where all the problems you say started in the body.
Yes.
Although one of your problems that you had was for vision with macular degeneration since you were a child.
Yes.
Right? You were pretty much born with a macular problem, somewhere
Yes.
around birth, right?
Mm-hmm.
So really it started earlier on, but the neuropathy of the big toe was 1983, was one of the pivotal points for you with problems in the body.
Right.
And that toe was totally numb?
Yes.
And after your first protocol, or during your first protocol with me from January's protocol, how does your toe, and we're talking for 83 to 2000, 34 years or so,
Correct.
somewhere around there, you had numbness in that toe. How does your toe feel now with the big toe and the right foot?
It feels fine.
It feels fine. From your lower neck down to your waist, the back was numb.
Yes.
Correct?
Mm-hmm.
And how long was your back numb for? How many years?
I've forgotten now.
How many years do you remember her back being numb for?
I would say 30 years.
30 years of back
Yeah.
numbness. And now, and we just tested not only, in addition to you expressing the change in the sensory on your whole back, from neck down to the waist, of the
Yes.
numbness, you felt it back when I saw you in April, and now we're here again. We are in the middle. Today is June 18th of 2018. And what do you feel in your back now? Does it still feel numb, or can you tell the difference of sensations?
I can feel sensations, even light sensations.
Even light sensations, which
Yes.
you just did a test with her today.
Correct.
Yes.
Just a very light, like a feather,
Paper.
like a piece of paper, just gently going down your spine. You could feel
Right.
that, very light.
Mhm.
And you also feel, what else did you tell me? That it was different because you could feel now
Heat.
heat. So when you're
Yes.
taking a hot bath, before you couldn't tell hot temperature.
No, and I burnt myself.
And you burned yourself. And because you
More
couldn't
than
tell.
once.
And now you feel it. You can tell when it's too
Yes.
warm for you.
Mhm.
Isn't that incredible?
Yeah.
Numb
It
for
is
years.
incredible.
No, I think so. It's a very, very
Doing
incredible
it.
work,
Thank you both for sharing this.
Thank
and
you.
hopefully
Thank
you're
you.
welcome.
Doing all the hard work.
And hopefully in the future, as you continue to improve, we can maybe get another little peek and let people see another peek into your life of your
Oh
recovery.
yeah,
taking place.
definitely. Yeah, well, I think she's doing make a good actually contribution to other people.
Yes.
Some people may not really know.
This is all to help
Here will be
others out.
live example. Here where I was and where I am right now.
Yeah.
I think that will be a huge.
Yeah.
Because a lot of people, older people, they just give up a hope, because they really don't know.
Yeah.
They go to doctor, they giving them the pain medication, and eventually they go downhill, But here he's going opposite direction, going up the hill, So I think it's really amazing to me.
It's amazing. Hello, I'm Dr. Herman here with another great development, great progress for a patient of mine. This lovely lady right next to me is coming here from out of state. I'm practicing right now in my clinic in South Florida, and she's coming from out of state in the United States for several different conditions, one of which is for neuropathy that was pretty much throughout, and if you want to step in, sir, if you can, and you're a very educated person, you're a chemist, you're both coming from laboratory experience, so you both have been around where you have a good type of let's say, investigation series of points that you're going to make before you can make a decision of what you're going to do for your health, right?
Correct.
So one of your conditions that you came here for is for neuropathy,
Yes.
right? And you've had the neuropathy in your body, one part of the body was your big toe, the great toe on the right foot. You had neuropathy?
Yes.
And that was a numbness in that toe for since
1984. At least 84.
So between 1984 and 2018, when you started with me in January of 2018, you had numbness of that big toe.
Yes.
And that's where all the problems you say started in the body.
Yes.
Although one of your problems that you had was for vision with macular degeneration since you were a child,
Yes.
right? You were pretty much born with a macular problem, somewhere
Yes.
around birth, right?
Mhm.
So really it started earlier on, but the neuropathy of the big toe was 1983, was one of the pivotal points for you with problems in the body.
Right.
And that toe was totally numb?
Yes.
And after your first protocol, or during your first protocol with me from January's protocol, how does your toe, and we're talking for 83 to 2000, 34 4 years or so,
Correct.
somewhere around there. You had numbness in that toe. How does your toe feel now, the big toe in the right foot?
It feels fine.
It feels fine. Good. And you also said that you had numbness from your lower neck down to your waist. The back was numb.
Yes.
Correct? And how long was your back numb for? How many years?
I've forgotten now.
How many years do you remember her back being numb for?
I would say 30 years.
30 years of back
Yeah.
numbness. And now, and we just tested not only, in addition to you expressing the change in the sensory on your whole back, from neck down to the waist, of
Yes.
the numbness, you felt it back when I saw you in April, and now we're here again. We are in the middle. Today is June 18th of 2018. And what do you feel in your back now? Does it still feel numb, or can you tell the difference of sensations?
I can feel sensations, even light sensations.
Even light sensations, which
Yes.
you just did a test with her today.
Correct.
Yes.
Just a very light, like a feather,
Paper.
like a piece of paper, just gently going down your spine. You could feel
Right.
that, very light. And you also feel, what else did you tell me? That it was different because you could feel now
Heat.
heat. So when you're
Yes.
taking a hot bath, before you couldn't tell hot temperature.
No, and I burnt myself.
And you burned yourself. And because you couldn't
More than
tell.
once.
And now you feel it. You can tell when it's too
Yes.
warm for you.
Correct.
Isn't that incredible?
Yeah,
Numb
it
for
is
years.
incredible.
You also said that your legs felt like wood, but now you have, and that was constant, like a wood, like just a dull kind of nothing there. Now, do you have any sensation in your legs?
I have sensation from the
From the
mid,
knees?
from the knees up. I think it's normal. From the mid shin down, it is not completely fixed yet.
Not completely fixed yet, but is it partially? Do you have some on and off days with the lack of sensation from the shins down to the feet?
Yes, I do.
Yeah. So it's not completely fixed yet, but are we moving in the right direction? Because you can actually feel things at some times of the day.
Exactly.
Yes, good. And you also told me that there was something else here. You said to me, because of the amount of, you're dealing with a lot of back pain, the posture is not so good, right?
Right.
Right, so, and you use a walker to get around.
Yes.
Okay, so with your posture being a problem, and that maybe that's part of causing all of the back pain, and you've been through physical therapy, which gave you not sustainable relief, right?
Right.
Right, but it does give you some, maybe 20% relief, but it's not consistent, it's not sustainable with that method.
Right.
Right, okay. So one thing that you mentioned is, you said to me something different about your hands and feet, because you have a change in feeling in your hands and feet, which you think that you're not, what did you say before?
Yes.
Foot and hand pain is not noticeable as much because the back pain is there. Remember what you
Yes.
said? Yeah. So what does that mean? Now you actually have some normal sensations in the hands and feet, though.
Yes, I'm beginning to have sensations in the bottoms of my feet, on the outside of each foot, and my hands, fingers have been numb for some time, but that is getting better.
Getting better. And with that getting better, would you say, I didn't ask you this before, do you think it's like 10% better in the hands? Do you think it's like 50% better, 80% better? Or is there
It's maybe 10 or 20%
10 or
better.
20%? So you can feel things in your hands, you know what you're doing with them.
Yes.
Yeah. And this is after how many years of suffering with the hands and the feet of the neuropathy?
Well, I don't remember, but since the 90s.
Since the 90s.
Yes.
Constant numbness, just
That's
not
almost
Yeah.
25 years.
25
at least.
years or so, at least 25 years of numbness in there, and you're getting sensation back.
Yes.
And this is without any drug that we're doing.
No drugs.
Right. Now, something else that's really important. Now, first of all, I'm going to tell all you watching, this is just an intermittent, this is not intermittent, excuse me, this is this is a step along her path, this video. This is not, we're not claiming that she's completely recovered yet. That will come as we keep moving along and doing this work together. But this is a step in the journey, because when people are calling my clinic and they say, well, I've tried everything under the sun, I'm under every doctor, every kind of practice, every type of therapy, every diet, everything, and I'm not getting anywhere. Here we see that for somebody who had numbness of the back, numbness of the hands and feet for 3 decades,
Yes.
maybe more, and now you have feeling in your back, you have feeling,
Yes.
getting feelings, thighs you could feel, hands and feet, you're starting to get feeling. Now something else that's really important to cover, and the toe that was numb since 1983, you feel,
Yes.
and it's consistent, sustainable.
Yes.
Now, something else that's really remarkable is about your macular degeneration
Oh,
you've had ever since you were a little girl.
Right.
Can you tell me something of what happened in her last protocol? Maybe can I let him butt in? Because
Sure.
he put it so eloquently. He stated it, which we were not even, I was not aware, you weren't sharing with me today, of what was going on
forgot
with
about
you.
it. There's
Yeah,
so much
how
other
could you forget?
stuff
so,
going
so
on.
much other good stuff. So tell me, what did you say? And your background,
He's a chemist.
You're a chemist.
Yes.
So you're a pretty smart individual. You know how to research
I don't
things and
think
do
so.
it. I think you are. I think you are. What did you tell me happened with her in her second protocol through this April protocol before coming back in?
Yeah, I think one day she told me was that it was kind of amazing. She was able to see through her eyes. She just couldn't believe because she has been seeing so much,
White
vision
fog.
going down all the time, and all of a sudden, she said she can see me better. I was really amazed at how could this happen. And
She
she
was-
was also amazed herself too.
Yeah. Even seeing like petals on a flower.
Well, I didn't look at any flowers, but I could see details on a car, and I could
Details.
tell what color the car was.
That's pretty incredible. And before that day, or you had 2 days, I think you said, of this experience.
Yeah, twice.
Twice in that last 2 months. So you could see details and colors, but usually when you look at a car, what is it to you? Just a big blur
It's just a big blur.
of gray or
Gray,
white or something?
unless it's a gray or a gradation of gray or white.
Right.
Yes.
So usually it's just like a fading of a blur of gray and white. But you were
Yes.
able to see blue. You could see like if something was red.
I saw, and it would be difficult to see blue,
Mhm.
I would think. Now, red you could see. I could see orange or red,
Mhm.
but the blues and greens and things, they would look gray.
Look great. And what did you also tell me? Sitting across the desk from me today, you could actually tell what I was wearing.
Yeah.
You could see my vest on, right?
Yes.
And that was impossible before.
Yes.
Yeah. And what else? The final thing, and then I'll let you go, and I really appreciate you helping to share this with the world of what's taking place here. Did you tell me today, because one of the symptoms of the macular degeneration, it has been a what in your fields of vision?
I'm sorry. I
You
don't.
said about the white spot in the eye.
Oh.
The white, looks like a white puffy.
Yeah, the left eye, in the central part, was just sort of a creamy white color, and at times of the day I could see a little bit of light around it.
A little light around it, but always a creamy white color in the center
Yes.
of the field of view of the left eye.
Yes.
And right now, what did you tell me today when we came up from the exam? What are you're
I
in
can see-
disbelief that you
I could see the light.
could see light, you don't see the
I don't see
creamy
the
white spot in the eye.
No, the white spot's gone.
The white spot is gone.
It was covered probably 3/4 or better of my eye.
And how long did you have that white spot in your field of vision of the left eye? How many years have you been dealing with that in the macular degeneration?
Oh, that was it. Started. It was by New Year's Day of 2012. It was gone. I
So
mean,
you've got
the
about 6 or
white
7
was there, and I couldn't see.
like 6 years of the white in that left eye, and you
Yes.
haven't been able to see in the and you've been to a macular degeneration specialist who said there is nothing you can do,
Exactly.
and this is it, right?
Yes,
Yeah.
And now today you actually can see without that white spot in the eye.
I can.
Isn't that remarkable? You're actually in disbelief because you kept looking for it, but you couldn't find it.
Yeah, that's
I'm
right.
still looking for it.
You're still
I don't
looking.
want to see it.
We don't want to see it, but we're going to get it away completely to make that sustainable. But it's pretty amazing.
It's
So
wonderful.
You're having good improvements. I know it's not good enough yet because you still have pain in the back, and we still have a lot of work to do. But you're seeing things take place. You're actually literally seeing things take place,
Yeah,
And it's all
Crazy.
painless.
and it's painless. This excellent. Anything else that you want to share?
No, I think you made excellent progress here, and it's unbelievable that a person who has no hope, is going down the hill, is improving.
Yeah.
And I think it's very amazing to me.
It
And
does.
what-
It gives me hope. I want to go home and make lace again.
Excellent. Yeah. Is there anything, what we talked about earlier when, you found me online and you watched some videos of me, but you shared
Yeah,
about,
I was impressed with your
degrees and
knowledge, yeah.
education and background. Is there
Correct,
anything that,
correct.
what is yours, since you're definitely a very educated individual, is there anything that you know?
I think I was impressed with your knowledge. Your videos are very, very, I think, informative, and just show you that you have a lot of really deep knowledge about things.
And I was also impressed with that and the just how much you knew.
Yeah, I also actually told my
Just-
brother in India, I said, that look at the videos, your videos, and I think they watched it. They were saying they're really good. Actually, I keep on telling on when I talk to them on the phone, I was telling them, she got to see, but they were very encouraged to see that she's getting sensation.
Mhm.
When they hear about her eyesight, they be even will be amazed.
It's amazing.
Yeah, and also I told them it's all natural.
All natural.
That's what they
real-
like is
real
it's not
incredible.
no drugs,
Yeah. Real incredible science.
No, I think so. It's a very, very
You're
incredible
doing it.
work,
Thank you both for sharing this.
Thank
and
you
hopefully
for
you're
doing
welcome.
all the
You're
hard
welcome.
work.
And hopefully in the future, as you continue to improve, we can maybe get another little peek and let people see another peek into your life of your
Oh
recovery.
yeah,
taking place.
definitely. Yeah, well, I think she's going to make a good actually contribution to other people.
Yes.
Some people may not really know.
This is all to help
Here will be
others.
live examples. Here where I was and where I am right now.
Yeah.
I think that will be a huge.
Yeah.
Because a lot of people, older people, they just give up hope. Because they really don't know.
Yeah.
They go to doctor, they giving them the pain medication, and eventually they go downhill, But here he's going opposite direction,
Going up.
going up the hill, So I think it's really amazing to me.
It's amazing. Thank
Yeah,
you
yeah.
for sharing. I appreciate your time coming in and letting me share this with people.
Yeah,
Thank
yeah,
you for
yeah.
helping
Thank
me.
you for hard
You're
work.
welcome.
And
Keep the hope.
keep it up, good work.
Thank you.
I'm sure people thank you forever
Yeah.
doing this noble work.
Thank you.
Yeah.
Appreciate it.
Yeah.
Our number here that you can call to get an appointment is 954-370-3100. 954-370-3100. I'll put the email address to my lovely email assistant who can help, clinic assistant. She can help you make appointments, and we look forward to helping you too. See you soon.